Hi, my name is Debbie Bucher. I am a registered nurse and instructor in the nursing program here at Parkland College.
And I'm Molly Martin, a registered respiratory therapist and instructor in the respiratory therapy program. Today we're here to talk to you about the use of simulation in the health professions program at Parkland College.
Well, actually the doctors have ordered you a CT scan, so it's going to take about an hour for that.
Historically, simulation has been widely utilized by a variety of entities, such as nuclear power, aviation, civil services, and the military. Simulation is gaining popularity in the healthcare industry as well as in the academic health professions. The results of a study conducted by the National Council of State Boards of Nursing, the NCSBN, published in the Journal of Nursing Regulation, provides substantial evidence that substituting high-quality simulation experiences for up to half of traditional clinical hours produces comparable end-of-program educational outcomes and new graduates that are ready for clinical practice July 2014.
Having the opportunity to collaborate with other healthcare providers and students has broadened my horizon on taking care of patients and providing holistic patient care. We get the opportunity to learn from them and they learn from us.
Simulation has helped me with improving my assessment and skills because in certain situations there isn't as much time to overthink and stress about what you're going to do. You just have to do it, so it really boosts your confidence, and being able to hear certain heart sounds and lung sounds that you don't normally get to hear on patients in the hospital has been a really good experience.
The use of simulation gives students the ability to practice important patient care skills, patient assessment techniques, critical thinking skills, and interdisciplinary teamwork communication. Simulation allows students to develop and practice in a safe learning environment where mistakes are allowed and, most importantly, learn from. Students participate in faculty-led debriefings after each simulation. This reflection provides students with valuable insight on how they performed as an individual, as well as how they worked as part of a team.
Working well with nurses is key. Communication is key also. So working with iSTAN and knowing what they do and what we also do in interdisciplinary work is really great to know. Working as a team is better for the patient and just not individually work.
These are things that are going to happen every day in the hospital, and so Parkland really prepares you for communicating with healthcare providers.
Parkland College is fully invested in the use of simulation to support state-of-the-art learning education for all health profession programs. Each semester, Parkland Health Profession students log hundreds of simulation hours. They can expect to participate in simulation education throughout their course of program study. Currently, Parkland College simulation is used as an adjunct to clinical experiences. Opportunities for interdisciplinary team simulations exist throughout each semester amongst the varied health professions at Parkland and also the University of Illinois School of Medicine.
Now that you know a little bit about simulation, let's take a look at an actual simulation.
Dr. Cross, we have an increase in heart rate too and a decrease in blood pressure. We were 81 and 113 over 55. Now we are 124 and 106 over 63.
Ms. Phillips? Has she been unresponsive? Ms. Phillips, can you answer me?
She wasn't answering me right before I placed the Foley, but before that she was saying that she was dizzy.
Okay. Did we get the fluids running? How much oxygen you have her on?
10 we run 10 liters.
Okay. Is it firming at all? Okay. I don't see any lacerations. Can we go ahead and get 0.2 milligrams of methogen IM, please? Just keep doing it? Yep. Just keep massaging. I'm just going to go ahead and feel if you don't mind here. Ms. Phillips, can you hear me? Why don't we get her bed in Trendelenburg?
Okay, I can do that down here.
As you can see from the video, simulation is a tool used to mimic situations and events that healthcare professionals would experience in the clinical setting. Simulation uses a variety of scenarios and various levels of simulators that range from low to high fidelity capabilities to enhance the learning of our students. Now let's take a moment to hear some individual views about simulation.
So with the simulations are a later stage of the education that we get at Parkland. We begin by hitting the books. We spend the first semester doing that and making sure that we have the appropriate knowledge that we can apply in practice. And the simulations come in later where we get to apply that knowledge in patient scenarios that vary across the spectrum so we can see where we're at before we even have contact with the patient.
This whole simulation lab was designed to increase cross-communication between the various disciplines so that the nurses aren't afraid to talk to the doctors are okay talking to the nurses, don't talk down to the nurses, and everybody has to figure out how does the RT fit into this. It's the scenarios that we put them in are ideally we kind of throw all three together in something that they have to figure out fairly quickly because we have a time-limited simulation. And that sort of puts a little bit of pressure on them, but also, you know, the quirks tend to come out when people are under pressure as well. So it allows us to see, you know, the good and the bad, and hopefully more good than bad.
We can, with the simulations, we can reinforce, whereas when we're with a patient, you only have one shot typically to do what you need to do for the procedure or the practice. In the simulations, it's a slower pace. We can reinforce the skills, learn them, and then apply them.
iStan has definitely given me the confidence to improve my communication, both with patients and their families and other healthcare providers.
Working with nurses was scary at first, not knowing what they do, but then at the end of the simulation, knowing what we do, what they do, and it all interconnects, knowing that communication was very good throughout the whole simulation.
I feel that our instructors have really prepared us well, not only in the classroom but with iStan and clinical. Everything that they have taught us is real life scenarios. I see it at work, I see it in school.
As you have just heard, practice during simulation is a very important part of development in the healthcare professional. Participation in simulation helps the student to practice the knowledge, skills, and professional behaviors of healthcare professionals. This program has been created as a pre-simulation requirement to prepare the student for simulation in their clinical or academic classes. Your instructor will give directions on how to access the class.